Hi, I'm Marguerite McDonald. I am a clinical professor of ophthalmology at NYU and Tulane and a cornea specialist with Oakley Vision on Long Island. I was searching for a better way to do pterygium surgery. The surgical technique that is most commonly used, conj autograft, which I had been using, takes a lot of time in the OR. There's suturing. You're using up a lot of conjunctival real estate that might be needed later for glaucoma surgery. There's pain, relatively slow recovery of vision, and the eye stays quite red for many weeks. So I was looking for a better way to do the surgery. Our retrospective analysis, we discovered that the patients had a shorter time in the OR. We were not using up any conjunctival tissue at all, no conj autograft, no sutures, no glue. And we found that the patients recovered so much faster, and for the first time ever, there was a 0 recurrence rate. And the patients were followed for quite a long time. The average was 394 days, and no one was followed for less than 174 days. And we all know recurrences occur very quickly. But surprisingly, we did not have to taper them down off steroids for months. They were off quickly, a rapid 1-month taper, and often only 2 weeks. They recovered so quickly and the eyes were so quiet. So the patients recover very quickly. They're quite comfortable. Virtually no need for a narcotic of any kind, which is commonplace with most pterygium removal techniques. And a 0 recurrence rate was a great shock to us. About 13% of the cases were secondary pterygia. In other words, they'd already had a recurrence with a different technique, and we all know those are really tough to treat. And the recurrence rate is extraordinarily high in secondary pterygia. We had none, as well as, of course, our primary pterygium cases. So it was a win-win-win for the OR, shorter time in the OR, no glue, no sutures. The use of the amniotic membrane delivered healing factors that sped the return of vision, corneal healing, conjunctival healing. I used a disc, a Biovance 3L, which is a triple layer amniotic membrane, decellularized. And it just sticks like flypaper. You don't need to use any sutures. And I put a bandage contact lens on top, and the bandage contact lens would usually come off a week later. If there were little shreds of the amniotic membrane still on the eye, we just left them. We figured the longer it stayed there, the more goodies it would dump onto the ocular surface. One technical tip would be that as you remove the pterygium, don't skate all over with cautery. You know, it's fun to use the eraser tip and just cauterize the entire base till it's completely white. That's not good. I usually use just a needle tip cautery, and I get the biggest bleeders, but to leave the bed vascularized is an important thing. So besides the magic sauce, the triple layer amniotic membrane, the placement of this disc partially on the cornea over the corneal defect, and the other part tucked under the remaining conjunctival tissue. It's sticky, it'll stick right away, and that placement really is key to the fact that you can get away with no glue and no sutures.